Welcome everybody. Welcome to our fourth National Innovation Collaborative event since our birth in very late 2020. And it's great to see the growing interest in these events. We get really good numbers, but more importantly, we get fabulous connections made by everyone that attends. For those who don't know me, I'm Breed O'Brien. I'm the Deputy Director of Digital Health at NHSX. And me and my team have the privilege to work with lots of people on this call and delivering the regional scale programme, which is supported by our Innovation Collaborative. And I'm co-chairing the event today with my colleague Laura, who I'm just going to hand over to, because our Innovation Collaborative is a partnership between NHSX and the AHSN network. Laura.
Hi, good morning everybody. My name's Laura Rooney. I'm Director of Strategy at Health Innovation Manchester. We're part of the National Academic Health Science Network, and as Breed says, we're a delivery partner for the Innovation Collaborative to support the sharing of learning the best practice across England.
Laura, do you want to keep going on the agenda or?
Sure. Yeah, no, happy to. So we've got, as Breed said, this is our fourth Innovation Collaborative event, and it's great to see continued interest in so many people attending. So thank you everyone for coming this morning. We've got a really great agenda packed for the next few hours. We'll be starting off with a keynote from Dr. Tim Ferris, who everyone I'm sure will be interested to hear your thoughts, Tim. And then we've got various panel discussions with some of our regional colleagues who are delivering this work on the front line. Then we'll hear from Penny Pereira at the Q initiative to take us through the links between digital and improvement. Then we've got some further regional spotlight presentations from colleagues in the Midlands to take us through 3 projects of where they're deploying tech-enabled care into practice. We'll then hear from people involved in the Innovation Collaborative, both from NHSX and the Academic Health Science Network, about what's to come this year. And then we'll be having a panel discussion with Tara Donnelly and Hugh McCorney from also talking about the links between digital and improvement agenda. And lastly, please, if you could hang on for our Slido session at the end, we're really keen to build on insights from the event to inform future work. So thank you. Next slide, please. So what's made these events really special in the past is a huge amount of audience participation and interaction. So please feel free to post comments, questions, reflections in the chat and engage and connect with each other. You also will have time at the end of each session for you to pose questions to our panelists or speakers. So that's really made these events special, so please continue to do that. We've also got a hashtag NHSInnovCollab, if you could tweet away. Always helpful to spread the word through social media. And then just a couple of housekeeping items. If you could keep mics and cameras off unless you're speaking. And if you could avoid, if we can avoid any overt product placement or marketing in the chat, that would be really helpful, because this event is geared towards health and care staff and delivery of tech-enabled care into practice rather than promoting any products. We will be using Slido at the end, so if you can have your smartphones ready to take a link into the QR code. And don't forget, you can turn on live captions if you go to more options on Microsoft Teams, which is the 3 dots just at the top. So it's really great to see so many people joining and continue to join in the event. And we are recording, so we will be publishing this on Future NHS for those who cannot come today. Okay, fantastic. Next slide, please.
Okay, I'm just going to quickly remind, so for people who haven't been to one of these events before, I just want to quickly remind you of the vision for our Innovation Collaborative, which is to foster a learning and support system to enable all our teams across the NHS and care sector to rapidly connect, to learn from each other, to share successes, and actually sometimes more importantly, the valuable learning from challenges. And in doing so, to raise the ambition to co-design solutions with staff and citizens to scale digitally enabled care at home. And I'm delighted, over 205,000 people have been supported to date, and that's a number that's constantly rising. We've got over 1,200 people who've joined the NHS Future site, and again, actively sharing. And thanks to our innovator colleagues who are on the call, we've got 70 platforms being used across England to support remote monitoring across the 4 areas of long-term condition management, annual physical health checks in mental health, working with the care sector, particularly remote monitoring in care homes, and through our tech-enabled virtual wards, which we'll hear more about through our panel. So really important work, and thank you all for your contributions to this. Next slide, please. Yeah. So as I've said many times before, this is about improvement enabled by the technology, and there is a theme through the session today about this. And we just thought it was useful to just show an example of if you look at this through the quadruple aim. So really thinking about the areas of impact across those 4 really important parameters of improved provider experience, improved patient outcomes, and I'm delighted we've got Barry as a patient joining our panel later to talk about how it's felt for him, improved patient experience, and the lower cost of care, because we have to work within a value for money concept. So this is a really, these are early learning from individual sites about benefits they have seen. And I've no doubt Tim will touch on evaluation later, but it's really important that we constantly assess the impact of what we're doing.